I just came out of a meeting of the Advisory Committee on Immunization Practices. Previously, the CDC had recommended COVID shots for adults, especially for those high risk or who are older. But now the CDC's ACIP committee has recommended that everyone talk to their doctor, individually decide.
I worry going forward that there will be more restrictions to vaccines in the United States.
Over the course of its 2-day meeting, the committee took up a combined shot for measles, mumps, rubella, and varicella, also known as chickenpox, as well as hepatitis B for newborns, and vaccines for everyone for COVID-19. We've seen that this really is a new committee. It has a new approach. Whether you like it or not probably depends on whether you like Robert F. Kennedy Jr. For the measles, mumps, rubella, and varicella vaccine, also known as MMRV, the committee decided that children under the age of 4 should not get that vaccine and instead should get separate shots, one for varicella or chickenpox and one for MMR.
I think what's important for context is that vaccine had only been given in about 15% of those in that age group. It had been recommended that the MMR plus V be given preferentially, but it was parents' choice. Some may worry about that increased slim chance of a febrile seizure. Others may say, my kid is not going to tolerate 2 shots, so I want 1. But having that discussion and understanding the risks and benefits is the beauty of the American healthcare system and that patient-provider relationship. And that has been altered by taking that choice away.
The committee's meeting was marked by a lot of confusion and some back and forth that isn't quite normal for this committee. The committee voted on whether MMRV vaccine should be in the Vaccines for Children program, for example, and then the next morning they undid that vote completely.
The hepatitis B vaccine, they were looking at changing a well-established childhood vaccine schedule recommendation without a lot of new evidence, and so to me that's concerning. You want to make sure that there's a reason to be revisiting some of this. So I worry going forward that there will be more restrictions to vaccines in the United States. Why it's focusing specifically on MMRV and hepatitis B, I don't know. There haven't been a lot of new safety data or concerns with these vaccines, and so it's unclear why it was raised to this committee as agenda items without going through work groups and the evidence to review framework. For COVID, it makes sense because FDA just issued their updated recommendation end of August, and CDC usually then would follow up on that. But to kind of proactively review vaccines that are well established with 20 years history is unusual.
The ACIP had 17 members, and in June, Robert F. Kennedy Jr., the health secretary, fired them all, and he replaced them with new ones. And all of them have some kind of medical background or association, but many of them are people who have questioned COVID shots in the past or even other vaccines.
For ACIP, you want somebody with really a deep bench experience around vaccines or some of these specific clinical issues and diseases. And this ACIP, at least from what I can tell, may have some experienced members, but overall not the experience the prior groups have had. And I think that was evidenced in many of the discussions yesterday where there were some fundamental issues they didn't understand.
Skeptics of this committee and of Robert F. Kennedy Jr., who really questioned how this committee would approach scientific decisions, in some ways have been proven right. The committee took a whole new approach to these questions and really placed a lot of emphasis on vaccine risks, which is something that's new and really hasn't been done before.